this is a balance parents need to make, because it's a decision. You need to make an informed choice with a balance of the available evidence. What other things are you recommending people do?
That once they have their lips closed, I can start working with their tongue. A lot of my patients have a low tongue position, which complicates sleep apnea problems and also teeth movement problems and tongue thrusting. Swallowing from a low tongue position, it has a thrusting capacity.
So I think what's important to point out here is that, Frank, you can't really make a lot of difference. You're not doing orthodontics.
Correct.
So you're not going to change, as you put it, you're not going to change the size of the box.
Correct.
Cool. I change the size of the box. That's
orthodontists, that's what they do.
Yes, some make it smaller.
Yeah.
And I'm not particularly happy with that.
But, so I have a small box.
Yeah, you have a small box. I have a medium-sized box. Okay, now, so Frank, we're gonna. I'm changing the size of the boxes. You're not.
I have to live with it.
You have to live with the box. So clearly, this is going to resonate with a lot of people who are interested in what I'm saying, because a lot of them aren't going to be able to get to an orthodontist, so aren't going to have a chance of me changing the size of the box.
Right.
All right. So what are you going to help these people who can't get the size of their box changed?
Okay, I have to have them be able to. I want to really get to the tongue. I want to get the tongue out of the floor of the mouth, up on the palate again. And that'll open up the airway. A lot of my patients have sleep apnea issues, and snoring's a major one, and that's really considered mild obstructive sleep apnea. So it's the beginning launching pad for severe conditions. But so I got to get the tongue up, and I work with people with tongue. Went to myofunctional therapy courses and learned about that. But it's really, I found it challenging with my patients with poor results with dealing with the tongue to try to get it up on the palate where it should be, until I found out that really, if I can get their lips closed first, then it's a shorter reach for the tip of the tongue to go up on the palate, and then overall, with time, the overall tongue up there. And so I had to, and then it was that improved compliance of tongue exercises, of which I have a standard one with my patients. So a lot of myofunctional therapy tongue exercises, I boiled it down to one that they would do consistently rather than 10 that they do sometimes.
Yeah, the best exercise is the one you do.
Yeah. And so it's really posturing the tip of the tongue on the anterior palate. And
on the end spot.
On the end spot.
Yeah, I've done that before, but carry on.
And then having the even young, my 3-year-old grandson can do it, and he does it all the time. And then press up on that spot with the tip of the tongue and hold it up. That works the suspension muscles of the tongue, the extrinsic muscles of the tongue.
So you're basically asking them to push hard on the end spot with the tongue. That's when you go 19 end spot, and you're going to push hard on the end spot for
10 seconds. Count of 10. Just count to 10 in your mind, and then relax it a little bit. Do that again, and do 10 of those, and that's one set. And I have them do 5 sets a day, especially right before they go to sleep.
Yeah.
And I say you're going to notice you've been successful when you can go to sleep after that exercise with the tongue on the palate, and you can wake up that same position. Then you know that you mastered that habit.
Yeah, I'm just normally waking up in the morning thinking what that noise is. I said it for another 10 minute snooze, but I will be thinking about where my tongue is in the morning. But okay, so Frank, any other things? What other things are you trying with your patients? Or is that the main thing? So you're mainly looking at the lip tape. You're looking at the what do we call this exercise? The end spot.
The end spot. Yeah.
End spot pushes.
I call them tongue push-ups.
Tongue push-ups. So tongue, this is
the tongue there in the palate and push up. And it's a tongue push-up.
Yeah, I think I've heard the
bicep,
term before.
Exactly. So you do a tongue push-up.
You're going to do a tongue push-up, and I think people are going to get far more out of doing a tongue push-up than they're ever going to do doing
push-ups.
Anywhere doing push-ups or bench presses.
Be much more healthy for them.
And I think it'll going to get you farther than bench press. And you think how much people are doing bench presses.
Yeah.
You don't need any equipment for this.
Right.
You should have a tongue already.
Yeah. And then it'll help them get the tongue out of the airway.
Yeah. Now, Frank, so I talked a little bit earlier on about, I was saying, my mealtime exercise, and I was interested. You said you went to West Point yourself. And I make the observation how people have had a military background tend to have, as you do, sir, A good body
I
posture.
appreciate that.
Yeah, a good body. So although you've got a small
Normal
box.
for me now, yes.
Yeah, well, it sets you in a good state.
Exactly. It's muscle
And
tone.
it's muscle tone. And I'm sure when you go and meet many of your peers from the same era
Right.
that weren't in military academies,
Right.
would you say you look a lot younger?
There's a fair percentage of them that have retained their more youthful look than the average population.
So the people who went to West Point
Right.
have done better than average.
Yeah, I go to reunions every 5
Yeah.
years, and as an overall average, looking at them versus people my age, I turn 70 next week, and so visiting a friend here in London.
Respect, 70-year-old visiting a friend in London. Frank, you're young and sprightly inside.
Well, thank you. In spirit, and it helps. It really, why I got in the tape to begin with was to keep my mind alert.
Yes.
And
Yes.
so I've noticed a tremendous improvement with mental alertness and not having complications from breathing problems at nighttime from not breathing.
And I think it's. I think this is important. I think it's fundamentally important.
Yes.
Yeah, Frank. Listen, it's been an absolute pleasure talking to you. Pleasure meeting you.
Pleasure.
Do stay in touch.
Well,
And it's I'd like to see. I will definitely trial out your lip with the lip seal tape.
I like your feedback.
Okay. Thank you very much indeed.
Thank you.